Odean Forbes, will be presenting and asking the trainee, Nurse Tailor, to do a return demonstration on a particular topic. This is part of the supervisor management course that I am doing. It's one of my assignments. How will this benefit Miss Tailor? She's assigned onto the ward, who sometimes works in the A&E department, and what will be taught today will be beneficial because she will be able to carry out this skill efficiently. So, this presentation will last 15 minutes. At the end of this presentation, the trainee, Ms. Tailor, will be able to define what venipuncture is and outline its importance. And a brief teaching session will be done by me, as said before. She'll identify at least 2 pros and cons of venipuncture. And a brief discussion will be done after same. She'll list the equipment needed to perform. Same will be given by me. And also, she'll do a return demonstration of drawing blood using the venipuncture method to at least 90% perfection within 5 minutes. Alright. What type of skill is needed for this presentation or for this return demonstration? Good communication skills. Also listening skills and observational skills. I must highlight Mr. Green, who will be assisting us by giving one of the vein for such, and also Mr. Edwards. The tools that will be needed for this presentation or this return demonstration as well is a syringe, a 22 gauge needle, some collection tubes, alcohol swabs, a tourniquet, disposable gloves, all of which are right here. So at first, let's start by asking for Trainee, Miss Tailor, how has your day been?
It's been rough, but I've managed.
Rough, you want to state a little bit what you would call rough in what sense?
Basically short staff, so a lot of demands.
A lot of demands. Alright, how do you feel about this presentation? Any nerves, anything like that?
Minor.
Minor, thank you. So tell me, have you ever heard the term venipuncture before?
Yes, I have.
And what do you understand about this term?
Collection of blood from a person's vein for laboratory testing.
Very good. Have you ever seen it or drawn any blood before?
I've seen it, but I've never done it before.
Very good. And what do you intend to achieve at the end of this presentation?
The skills of getting it done properly.
So let's start with a definition of a venipuncture. She was very correct. It's a process of obtaining blood samples from a vein, which can be used for laboratory reasons. It involves punching, injecting into one's vein and obtaining this blood. Alright? How important do you think venipuncture is? It is very important. Venipuncture allows multiple collection. So say for example, a little drop of blood, a little 3 ml can be used for various different things. You can use it for the UNEs, the LFTs, all of those things. So just a small amount of blood can be used for a lot of different reasons, a lot of different tests. So some tests can only be used, or some tests can only be performed by using the venous blood. Some diseases, only the blood from the veins can be used to pick up these form of diseases. Also, the vein itself is less muscular than the arteries. So it tends to be a little bit easier to obtain the blood from the veins. And in case of an episode of bleeding, it is always easier to use a vein. It flows the blood back. Remember, the heart pushes out the blood at a certain pace. So it's the blood going back, it is easier to use that blood. And the blood pressure in the veins, most times, are less than the arteries, as I stated. So the pros of venipuncture. it is less traumatic to the patient. Always remember, if the vein is thinner than the artery, it's less traumatic. Alright? It provides direct access to the circulatory system. To have the ability to draw a large volume of blood, and is less likely to be contaminated. Alright? So those are there. And it is faster in obtaining capillary blood. Now the cons, because the vein thinner, you can hurt the patient more. So if it's not done properly, you can cause some form of trauma to the patient. Alright? So you have a greater chance of needle stick, because remember, you're doing this directly. You're not using a machine. Injecting a person's vein, any little mishap can happen. So you have to be very focused, because it can cause a needle stick injury. And it requires a great patient stability, because some persons are afraid of needles. So you have to be careful. And it also have the potential for hemoconcentration to affect the test results. So some of the time, you put it in the tube. If it's not in the right tube, this blood sample might be discarded because it cannot be used. And it also increase the potential for hematoma formation, because if I burst the vein, it's going to bleed underneath and outside of the vein, so there will be a swelling. Alright? So, remember all things that were stated that we'll be using today. We're using disposable gloves. The 22 gauge needles are right here. The syringes, both for the presentation and return demonstrations, are right here. The tubes are right here. The tourniquet is right here. Wet alcohol soap, cotton, and dry cotton for after the procedure. I will now move into the presentation. So the first thing I'll do is ensure that my tube is labeled. This has to be done, because you don't want to use somebody else's tube on somebody else. So wrong patient blood going in the tube. Alright, so on this tube, already labeled, we have Mr. Green. Alright, so this is Mr. Green's tube. So let's go. Tube already labeled, it's right there. Wet swab open, can I drive here a little bit closer for me? Mr. Green is giving the left hand. Alright. As I said, quick and easy procedure. We tend to always put the tourniquet about 2 to 3 inches above the site. Like this, and pause that down. So applying the tourniquet about 4 inches above the site that we're planning to use, and then stretch it to ensure it is tight enough. Compress and give a pop of this vein. Ask Mr. Green to form a fist. He already rolled his fist into a ball. I will now put on my gloves for safety, dealing with fluids here. So, syringe, needle. We do this a little bit quickly because we already applied our tourniquet. Needle exposed. So I already identified our vein. Wet swab, we clean it. This one is well wet, so I have to ensure that we clean it. Again, we already identified our vein. We'll be using this vein. We'll be inserting now in the vein. Look for a push or a flashback. If you don't get a flashback, you surf the vein a little bit. There's a flashback. We pull the blood slowly, ensure that there isn't a lot of air. After we have collected as much blood, we cover and remove. We have collected 1 cc. We remove tourniquet. All right. We can insert in the top of the tube. This again can cause a needle stick injury. You have to be very focused. There you can see the blood going into the tube. Out. Sample collected. This to the side. Recapping of the needle to avoid needle stick. Now we'll have Mr. Edwards come forward so the trainee nurse Tailor can do the return demonstration. Discard of my gloves and the floor is yours. So you can see her putting on her gloves. She applied her tourniquet. Yes. Good luck. Remember, when you pull back, you don't send the blood, just retract the needle a little bit and surf the vein until you see that little flashback. Surf the vein a little, move it to the right. Alright, pull back. Looking for that little flashback in the needle. Right in the head of the needle, you're looking for that little flashback. Apply that tourniquet. This is made. Very good. Very good. Stop, slow down the plunge. Stop now. You can use the gel cotton, put it at the needle point, pull out the sample. Ask patient to compress. Remove tourniquet. Add sample. Here insert the the sample will pull itself. So just push it down. Yes, it will pull itself. Up, retract needle. Alright. Yes. Yes, sample to the side. Secure it bandage to ensure that there is no further going of any material there. Yes. Okay, remove the gloves and we'll the trainer was able to get it within 90% perfection on the second account, and it was done within the 5 minutes. Her first attempt, it was difficult for her to find a vein in which she got some blood from, so she got it on the second attempt within the 5 minutes. Also, is there anything to note? Do you remember what venipuncture is?
Well, yes. Venipuncture is the collection of blood samples from a patient's vein.
Okay, you remember the importance why we use the blood from the vein?
Yes. We use the blood from the vein in order to detect certain diseases. It's also used for multiple collection of blood samples. Also.
Alright, so do you remember two of the cons or two disadvantages that you might encounter during the venipuncture procedure?
It is at higher risk for needle sticks and increases injury to the patient.
Okay, very good. I must say it was a training well done. I must thank you guys for your time.
Yes, sir.
And I hope you have learned something and we'll see it in your training or in your practice on the wards. Thanks much, and you can keep the handouts for any further need of saving. Thank you.